Okay, so today we're diving into something that I think is so important and often overlooked, and that's how to handle dental care when you're going through serious medical treatments like chemotherapy or you're on bisphosphonates.
Yeah, when you're dealing with a major health challenge, the last thing you want to think about is going to the dentist, right?
Exactly. But the thing is, taking care of your mouth is actually a really crucial part of your overall health, especially when you're going through these tough treatments.
Absolutely.
So we've got a whole stack of medical guidelines here, and we're going to break them down for you and pull out the most important actionable advice so you can really understand how to navigate dental care in these situations.
Sounds good.
Okay, let's start with chemotherapy.
Okay.
Can you give us a quick overview of what chemotherapy is and how it impacts dental health?
So chemotherapy basically uses strong drugs to kill rapidly growing cancer cells. It's a systemic treatment, meaning it affects the whole body, but because it targets cells that are dividing quickly, it can also affect other healthy cells that grow quickly, like the ones in your mouth.
Oh, I see.
But that makes your mouth more vulnerable to problems.
That makes sense. And the guidelines really emphasize the timing of dental work when someone is on chemotherapy.
Right.
What's the general rule of thumb?
The general advice is to postpone any elective dental procedures while you're actively undergoing chemo.
Okay.
Because chemotherapy can weaken your immune system and make it harder for your body to heal.
Right.
So there's a higher risk of complications after dental work.
Makes sense. So if it's not urgent, it's better to wait.
Exactly.
But what if you do need dental care during chemotherapy?
Well, that's where communication with your medical team is key.
Right.
You absolutely need to talk to your oncologist or medical provider before scheduling any dental appointment.
Okay.
They can assess your overall health and how strong your immune system is at that moment, which can fluctuate a lot during chemo cycles.
Yeah, that's true.
This helps everyone make informed decisions about when it's safest to have dental work done.
That makes sense. Now, let's say you need a more involved procedure, like oral surgery.
Okay.
What's the ideal timing for that in relation to starting chemotherapy?
Well, if you know you're going to need oral surgery or other invasive dental procedures, the best thing is to have them done well before you start chemo.
Okay.
Aim for at least 10 to 14 days of healing time, ideally closer to 3 weeks.
Okay.
This gives your surgical sites a chance to heal properly and minimizes risks once chemotherapy begins.
So it's like giving your body a head start to recover before the added stress of chemotherapy.
Precisely.
Got it. Now, what about routine cleanings and checkups?
For routine periodontal care, the recommendation is a bit different.
Okay.
It's often best to schedule these appointments either a day or two before a chemo session or about a week after.
Interesting. Why is that?
Well, the reason is that you want to avoid having these procedures when your blood counts might be at their lowest point during your chemo cycle, which typically happens somewhere in between those time frames.
I see.
This reduces the risk of bleeding or infection.
So it's all about timing it strategically.
Yeah, exactly. And your dental team will be coordinating closely with your oncology team to make sure any dental work is done at the safest point in your cycle.
All right. Now, let's get into the specifics of blood counts.
Yeah.
Because the guidelines mention things like granulocyte and platelet counts.
Right.
Can you explain what those are and why they matter for dental work?
Absolutely. So these blood counts basically tell us how well your body can fight infection and clot blood,
Okay.
which are obviously super important for safe dental treatment and healing.
Right.
Granulocytes are the white blood cells that fight infection, and platelets help your blood to clot.
Got it.
Now, the ideal situation is when your granulocyte count is over 2,000 per cubic millimeter, and your platelet count is above 50,000 per microliter.
Okay. Those are the magic numbers.
Exactly. And these counts often recover to these levels around 17 days after chemo or right before your next cycle. And if your counts are in that range, then you can usually have both routine, invasive, and non-invasive dental treatments done safely.
So that's what the doctors are looking for.
Yep.
But what if the counts are lower?
Okay, so let's say your platelet count is below 50,000.
Okay.
In that case, the risk of excessive bleeding is higher.
Right.
So elective invasive procedures like a tooth extraction or gum surgery would need to be postponed.
Okay.
However, elective non-invasive treatments like a checkup or a gentle cleaning could likely still be done.
Got it. And what about if the granulocyte count is low?
Well, if your granulocyte count is below 2,000, your body's ability to fight off infection is weakened.
Right.
So again, elective invasive treatments should be put on hold to minimize the risk of infection.
Makes sense.
Elective non-invasive procedures might still be okay, but it's always best to check with your medical team.
So it really depends on the specific situation.
Yeah, there's no one-size-fits-all answer.
Now, what about emergencies?
Emergencies are tricky. If you have a dental emergency that needs invasive treatment regardless of your blood counts, you absolutely need to talk to your oncologist.
Okay.
They can advise you on the safest way to manage the situation, considering your overall health and how urgent the dental problem is.
So it's a team effort between the dentist and the oncologist.
Absolutely.
That makes sense. The guidelines also mention using preventive antibiotics before some dental procedures.
Right?
What's the current thinking on that?
The idea is that giving antibiotics like penicillin V before invasive procedures that involve bone or the inner parts of the tooth can help prevent infections.
Okay.
But interestingly, there's not a ton of solid scientific evidence to support this as a routine practice in every case.
So it's not a slam dunk.
Not necessarily. It's another area where talking to your oncologist is crucial to figure out the best approach for you.
Okay, I'm starting to see a theme here. Communication is key.
Yeah, communication is key for sure.
All right, let's move on to a common side effect of chemotherapy that I know a lot of people experience. And that's mucositis. Can you tell us what that is and why it's such a big concern?
Mucositis is basically inflammation of the lining of your mouth, the oral mucosa.
Okay.
It's a very common side effect of chemo because the drugs target those fast-dividing cells, and the cells lining your mouth are in that category.
Right.
Plus, chemotherapy can also trigger an increase in inflammatory substances throughout the body.
Oh, I see.
So it's kind of a double whammy.
And where in the mouth does mucositis usually happen?
It tends to affect the softer, non-keratinized mucosa, more so the inside of your cheeks and lips and the underside of your tongue,
Okay.
rather than the tougher outer surfaces like your gums or the roof of your mouth.
And what's the typical time frame for mucositis to develop and then go away?
Typically, it shows up about 7 to 14 days after chemo,
Okay.
and it usually starts to improve within 1 to 2 weeks after the chemo treatment is finished.
So it's a temporary thing, but I imagine it can be quite unpleasant while it's happening.
Oh, yeah, it can be pretty miserable.
Yeah, the guidelines describe it as feeling like a severe burn in your mouth.
Right, it can be very painful. The lining of the mouth gets red and tender,
No.
and the top layer of cells can peel off,
Yikes.
which leaves the tissues vulnerable to ulcers and increases the risk of infections.
Not good. So it's
Mhm.
not just about pain, it can actually lead to more serious problems.
Yeah, exactly.
What are some of the most common complaints that patients with mucositis have?
Well, the pain and ulcers make it really difficult to eat, drink, and even talk.
Oh, wow.
Some people have trouble swallowing, which is called dysphagia.
Okay.
They might lose their sense of taste, and it can be hard to get enough nutrition because eating is so painful.
That sounds awful. So what can be done to help manage mucositis when it's really bad?
The main goals are to protect the oral tissues and keep things as clean as possible.
Okay.
A simple mouth rinse made with salt and baking soda and water can be really soothing.
Like a homemade remedy.
Exactly. It's gentle and helps keep the area clean.
Makes sense.
And then there are topical anesthetics like viscous lidocaine that can numb the area for a bit.
Yeah.
And sometimes an antihistamine like Benadryl is mixed with a coating agent.
Interesting. Why is that?
The antihistamine has a mild numbing effect, and the coating agent, like milk of magnesia or kaopectate, helps create a protective layer over the irritated tissues.
So it's like creating a barrier.
Yeah, exactly.
And the guidelines also mention antimicrobial mouth rinses and steroids.
Right. Chlorhexidine is a common antimicrobial rinse that helps prevent infections.
Okay.
And in some cases, a steroid like dexamethasone might be used to reduce inflammation.
So there are a few different options depending on the severity.
Yeah, it really depends on the individual case.
Aside from those treatments, is there anything else that's important for managing mucositis?
Definitely staying well hydrated is super important to keep the mouth moist and help with healing.
Right.
And you want to avoid anything that can further irritate the mouth.
Like what?
Things like alcohol, tobacco, spicy foods, citrus fruits, and even very hot or cold foods.
Makes sense. Anything that could make the pain worse.
Exactly.
Okay, now let's switch gears and talk about bisphosphonates and their potential connection to a condition called osteocrosis of the jaw, or ONJ for short.
Okay.
First of all, what are bisphosphonates and why are they relevant to dental care?
So bisphosphonates are basically synthetic compounds that act like a really strong off switch for the cells that break down bone in your body.
Okay.
They have strong attraction to calcium, and they inhibit the activity of osteoclasts.
And what are osteoclasts?
Osteoclasts are the cells that are responsible for resorbing or breaking down bone tissue as part of the natural bone remodeling process.
Okay, so it's like a constant cycle of breaking down and building up bone.
Right, exactly. And bisphosphonates kind of put the brakes on the breaking down part.
Interesting. So what do they use for medically?
They're used for a variety of conditions like osteoporosis to increase bone density,
Okay.
Paget's disease of bone, which is a disorder that disrupts the normal bone remodeling cycle, multiple myeloma, which is a type of blood cancer that affects the bone marrow.
Wow, quite a range of uses.
Yeah, and they're also used for hypercalcemia of malignancy, which is a condition where the calcium levels in the blood are too high due to cancer.
Okay, so how do bisphosphonates relate to this osteonecrosis of the jaw?
Well, there's a difference in risk between the oral and injected forms of these medications.
Interesting. Tell me more about that.
So ONJ is pretty rare in people taking oral bisphosphonates. It occurs in less than 0.01% of users.
Okay.
But with the intravenous or injected forms of bisphosphonates, the risk is significantly higher.
Oh, wow, how much higher?
The reported incidence rates range from about 2 to 4%.
So that's a pretty big difference.
It is, so it's important to be aware of that distinction.
Definitely. Now, can you explain how bisphosphonates can lead to ONJ?
Sure, so as we talked about, bisphosphonates get absorbed by osteoclasts and prevent them from breaking down. Start over.
Okay.
They can also interfere with the formation of new blood vessels in bone, which is called anti-angiogenesis.
So it's affecting both the breakdown and buildup of bone.
Exactly. And this can make the bone more brittle and less able to heal properly.
Especially after trauma, like
Right.
dental surgery.
Right. Or even just regular chewing can be enough to cause problems.
Yikes. So the jaw is particularly vulnerable because it's constantly under stress.
That's right. And that's why this suppressed bone remodeling and reduced blood supply are thought to be the main factors in the development of ONJ.
Okay, so what happens if someone develops ONJ?
Unfortunately, managing ONJ once it's established can be really challenging.
Yeah.
And the treatments don't always lead to a complete resolution.
So it's not an easy fix.
Not really. Some of the recommended approaches include things like debridement, which is surgically removing the infected or dead bone tissue,
Okay.
sometimes bone curettage, which is scraping the bone surface, and local irrigation with antibiotics.
Okay.
In some cases, hyperbaric oxygen therapy might be used, but the evidence for that is still somewhat limited.
So it sounds like preventing ONJ in the first place is crucial.
Oh, absolutely. Prevention is key.
How can people do that?
Well, one of the most important things is to have a thorough dental exam and take care of any existing dental issues before you start taking bisphosphonates.
Makes sense. So get everything in tip-top shape beforehand.
Exactly. Things like gum disease or poorly fitting dentures should be addressed.
Okay.
And then once you're on bisphosphonates, maintaining excellent oral hygiene is critical.
So brushing, flossing the whole 9 yards.
Yep. And try to avoid invasive dental procedures if at all possible.
Got it. So it's all about minimizing risk.
That's right.
And it sounds like having that open communication with your dentist from the get-go is super important.
It's really the cornerstone of prevention.
Now, let's say someone does develop ONJ. What are the management strategies in that situation?
Okay, so the initial approach often involves using antimicrobial mouth rinses like chlorhexidine to help control any infection.
Okay.
And if surgery is necessary, it's usually done very conservatively and often delayed.
What do you mean by conservatively?
So it might involve smoothing out any sharp edges of bone that are irritating the tissues. Okay.
Removing any loose pieces of dead bone without going too deep.
Okay.
And only in very severe cases would a larger section of the jawbone be removed.
Okay, so they try to do as little as possible.
Yeah, exactly. The goal is to preserve as much healthy bone as they can.
Makes sense. Now, the guidelines also mention the question of whether to stop taking bisphosphonates if ONJ develops. What's the recommendation on that?
Well, unfortunately, there's not enough scientific evidence to say for sure whether stopping the medication will actually improve the outcome of ONJ.
It's a bit of a gray area.
Yeah, it's a tough call, and it really emphasizes the need for close collaboration between your doctor and your dentist.
To weigh the risks and benefits.
Exactly.
And what about antibiotics?
If there's an active infection along with ONJ, then systemic antibiotics are definitely needed to fight the infection.
Okay, so that's a standard part of treatment.
Right.
This has been such a helpful overview of a really complex topic.
Just to recap, what are the most important takeaways for our listeners about dental care during chemotherapy and bisphosphonate treatment?
I'd say the biggest takeaway is the crucial importance of clear and constant communication between your dentist and your oncologist.
Right. Teamwork makes the dream work.
Exactly. And if you're undergoing chemotherapy, timing dental procedures strategically and being proactive about managing oral complications like mucositis are key.
And if you're on bisphosphonates.
Meticulous oral hygiene, preventative dental care, and talking to your dentist before starting the medication are paramount.
So much great advice, and it's all based on current medical guidelines.
That's right.
Which is super important for our listeners to know now, given this whole intricate dance between cancer treatment, bone health, and oral health. What other questions might people have as they navigate these therapies?
Well, they might be wondering about the long-term effects of these treatments on their mouths.
Right.
Or which specific dental procedures are considered riskier.
Makes sense.
And how to best talk to their oncology team about their dental concerns.
Yeah, those are all great questions.
They are, and there's some fantastic resources out there to help people get more information and feel empowered to advocate for their own care.
Like what?
Organizations like the National Institute of Dental and Craniofacial Research, or NIDCR,
Okay,
and the American Dental Association, or ADA.
got it.
They offer a wealth of information and support that can help patients feel more confident in navigating this whole process.
That's so important because knowledge is power, especially when it comes to your health.
Couldn't agree more.
Excellent. Well, this has been an incredibly informative deep dive into a topic that I think deserves way more attention.
Thanks for having me. It's been great.
And I hope our listeners feel more equipped to take charge of their oral health during these challenging times.
I hope so too.
Thanks for listening to The Deep Dive, and we'll see you next time.
Bye. Bye.